All this snow and ice really puts a lot of people at risk for serious falls. And I don't know if you know this, in fact, but more than 1 million people fall each year and 12,000 die from their injuries.
So senior health correspondent Monica Robbins has an exclusive report on how Cleveland Clinic researchers built a device that could potentially predict who's most at risk for a fall and what can be done to protect them.
Obviously, the biggest predictor of risk is if you've fallen before, and I certainly have a few times. But now Cleveland Clinic researchers developed a device that can predict where I'm most at risk. It's a deceptively simple-looking walkway, and I had no trouble navigating the steps, turn, and descent. But each blade I stepped on was doing sophisticated measurements, assessing my risk.
This would suggest that you don't have a muscle strength issue because you're walking up as faster than you were descending, but maybe there's something on the descent phase that would be a concern.
Of course, a patient could be recommended for physical therapy, but this can be more specific.
Some people may be at risk because they have deficits in muscle strength, right? So they would be going up the steps potentially slower. Some people may have coordination difficulties. Individuals with Parkinson's, for example, may. And they may have problems with the turn. So we're able to segment that out.
Or it could be vision issues. While less than 6% of falls happen on steps, they have the highest fatality and injury rate than other falls. This device helps to pinpoint an actual reason.
And if we can understand why you are at risk for falling, we can recommend the right intervention to reduce that risk.
Dr. Alberts is looking for healthy older folks and Parkinson's patients to be part of the SafeGait study, using the stair ambulation functional gait assessment, a simple walk that could prevent serious problems down the road.
Dr. Alberts hopes a device like this would be integrated into Medicare wellness assessments to evaluate focus, and it could also be very valuable in nursing homes to evaluate residents for risk of fall and prevent them before they happen.
Okay, so here's my question. Is there any indication that the risk is different for men and women?
Actually, more women fall than men. You know, studies indicate that women fall more often than men, but you know what? Anybody can be at risk, especially people not paying attention or maybe on their phone. Please remove all the snow and ice from your steps and sidewalks, because falls are the most common injuries among male carriers too. And if your elderly neighbor can't do the shoveling, be a good neighbor and help out, get it done, especially now as we head into these frigid temperatures next week. And we just saw what happened at the nursing home. This is really, really dangerous time.
That is such good advice, especially for your postal carrier. And even think about all the Amazon drivers and the delivery people.
Right.
Just for their sake too.
Absolutely.
Thank you, Mom.
Sure.